Hi everyone, welcome to Q&A with QuneUp. My name is Simone Ammons. Every week we're going to spend about 2 minutes-ish discussing various topics in the life science manufacturing industry. I think sometimes we as more established veterans in the industry, we tend to take terminology and best practices in the industry for granted. And many times newcomers to the industry may not be totally familiar with all of these terms just yet. Also, other team members in other departments that don't interact with the manufacturing floor may not be as familiar as we are as veterans in the space. So let's get into it, shall we? So one of the first areas I want to start with is FDA 483 warning letters. So the FDA, the Food and Drug Administration, they do routine inspections of U.S. manufacturing sites. Sometimes they're expected, sometimes they're unexpected. If they see things that they like, clear SOPs, we're adhering to our SOPs, we have good deviation management, we have an effective contamination control strategy, then most times you get the green light to keep things moving and keep on. However, if the FDA inspector does not like what he sees, he can issue what's called an FDA 483 warning letter. And all that is just telling the manufacturing organization, you have a few things you need to check up on. In the drugs and biologics category, that's where I'm mostly focused on, we've seen the number of FDA 483 letters being issued decline over time, and that's really directly related to the pandemic. Coming out of the pandemic, however, we've seen a pretty big uptick coming out of the pandemic. These numbers are starting to rebound, and so it'd be a good idea to get things in order when you're expecting or not expecting your next FDA site visit. So some good things to think about: 1, are your manufacturing batch records clearly being executed? 2, are your equipment records up to date? And then 3, are all of your personnel sufficiently trained on all procedures? It's always important to keep a close eye on what keeps coming up in these warning letters. These 483 warning letters can help you better understand what the FDA is keeping their pulse on during inspections and site visits so that you can stay ready for your next audit. Stay tuned next week for more insights on manufacturing in the biopharmaceutical and life science industries. Thank you.